Hi, Julie-Ann. How are you doing? It's just great to see you today.
Great seeing
and I
you
really
too.
think this is going to be a great experience. Hi, I'm Dr. Gerry Fishkin.
Hi, I'm Julie-Ann Goode.
And welcome to Psyched. I'm the author of 4 books, including my most recent, The Science of Shame and Its Treatment. I've been in clinical practice since 1970 as a psychotherapist.
I've been in clinical practice for 6 years, and my specialties are trauma resolution and dual diagnosis substance abuse work. So, how are you doing today, Gerry?
I'm doing great, Julie-Ann. I was thinking about this episode, and what I really wanted to open up with, aside from our topics, is gratitude. I find that for me, gratitude is probably one of the most important parts of my life, because I think we forget about what gratitude means. I think with gratitude, we take things for granted. And in life, I think we have to focus on what is meaningful. What are we happy for each day? Because I think we forget that. We get so tied up in the process of living and the ADLs, the activities of daily living, that we forget about the gratitude behind it, that we're able to do those activities, that we're able to appreciate our family, our friends, our home, our jobs, whatever gives us meaning and purpose in life. I think we tend to forget that. So I really wanted to talk about that as an opening today, because it's meaningful to me and it's really important.
Yeah, and today I am grateful that I'm well. I've been sick for the last couple of weeks, which is one of the reasons I couldn't help co-host one of the last shows.
Yeah, please don't breathe on me either. Do not do that, because we have to get through this hour together.
We're fine.
Thank
at least
you.
I'm not coughing.
Yeah, I don't need any downtime.
So we're good. Yeah,
Okay.
so I'm grateful to be with you today, because you make us who we are. And I'm hoping that this will help you with your daily gratitude also, because we're trying to pass on some information that will be helpful to you in your daily life and make it better. So today on What's Trending, we're going to be talking about bullying and the different aspects of it and information.
Including the effects of bullying.
Effects of bullying, yes, exactly. And then the second segment, we are going to be talking about Gerry's new book, The Science of Shame and Its Treatment. So join us on stage.
What's trending? What's trending? What's trending? What's trending?
So Julie-Ann, why are we talking about bullying today?
Well, Gerry, according to the National Bullying Prevention Center, more than 1 out of 5 students report being bullied, and that's reported. So 64% of those children who were bullied did not report. That's a huge amount of children. Why didn't they report? Probably due to being ashamed of being in the incident and also being threatened by the bully. So the top 3 reasons for being bullied reported by students were looks, body shape, and race. Victims of bullying are typically smaller. They're more sensitive, unhappy, cautious, anxious, quiet, and withdrawn. They are often described as passive or submissive. They can be seen by the bully as less likely to retaliate and thus be an easy target.
Bullying falls under 4 different categories. Bullying can be physical, and that includes fighting, hazing, headlock, inappropriate touching, pinching, spanking, shoving, teasing, threatening, tickling. It's an unrelenting physical process of bullying that causes the victim incredible pain. Sexual bullying is any behavior, whether physical or non-physical, that is based on a person's sexuality or gender, and especially relates to the LGBTQ community. And I think that I saw a show last night on Nightline, and there was a transgender girl. She talked about being bullied unrelentlessly and being treated in such a horrible way when all she was trying to do was be who she was. Verbal bullying is teasing, taunting, name-calling, and profanity. We might say that that might look normal in a kid community, but it's not. When it's repetitive, it's not healthy. It damages the child. And the fourth is what is most current today that we focus on, cyberbullying. And this is so important. When anyone is tormented, threatened, harassed, humiliated, embarrassed, or otherwise targeted by the bully using social media. And it can happen 7 days a week and reach a child even when they are alone. And many deaths by suicide have occurred because of this. Again, we call that bullycide. When a child is alone and unprotected, and they're on their social media and somebody is bullying them, it's frightful and horrific, because that child is alone. They have no one to communicate with, and they're scared. That's why this is so important. Keep your eye on your child. Julie-Ann.
The common behavioral elements to all bullying include hostile intent of the bully. The harm caused by bullying is deliberate and not accidental, and is pre-planned most of the time. There may be some spontaneous activity coming out of it, but a lot of times the bully is waiting for the victim, and that happens on a common occurrence. There's an imbalance of real or perceived unequal power between the bully and the victim. There's, the bully wants to hawk over the victim a lot of times, because that's where they feel that their power for living or whatever, their intent is caught up in that power structure. The repetition of inappropriate behavior causes a dysfunctional and odd relationship between the bully and the victim, and mostly carried out in social settings and likely to invoke attention by bystanders, because a lot of times the bullies and maybe even the victims are not getting that much attention from the home front. So this is a way for them to act that out and say, you know what, I really need to feel special for the moment. And last, bullying is motivated by perceived benefits, like gaining attention from bystanders, and also on social media, where you never know where that message is going to be spread to. That is the hardest part of bullying nowadays. This is what we're dealing with over the last decade or so, and it makes it so different from when we were being bullied as children,
right?
Because that was so localized. Now it's spread all over, and you don't know where that message is going to.
Absolutely. And apropos to that, this type of behavior upon a child creates incredible distress. Victims suffer mild to severe psychological, social, and emotional problems as a result of this. There's physical and psychological problems, including depression, anxiety, anger, excessive stress, and learned helplessness, with a high potential for suicide, or what we call bullycide. And the key feature of being bullied is the experience of feeling profound shame. I'm not good enough. I'm not smart enough. I'm not capable enough. I'm not even able to protect myself. That's the message. These victims often feel as though their life is falling apart. They have a significant drop in school performance, and as parents, you got to watch for that. If there's a major drop in the child's performance, something is going on. The child becomes insecure. They lack trust, exhibit extreme sensitivity, or mental illness, and they can develop an avoidant personality disorder. Remember, they're avoiding the trauma of the bully. They can develop PTSD, that is, become hypervigilant, with sleep disorders, insomnia, generalized anxiety disorder. They can have eating disorders as a result of this. The bully wants their victim to feel the same shame and insecurity they feel, either consciously or unconsciously. And as the bully grows up, this behavior doesn't go away. What we find is that they develop different social disorders or have a higher incidence of engaging in criminal activity as they age, and especially in their interpersonal relationships. They become bullies in their marriages, in their partnerships, and they become very difficult to be with.
Yes, they do. Most definitely. So what can we do as a general public to help out the victims and to decrease bullying? Research has shown that school bullying prevention programs helping the bullies and the victims come out and say, hey, I've got a problem with this and I really want, maybe the bully says, I really want to stop this behavior. And the victim comes forward and says, I need to tell a safe person that this is happening to me. Also, bystanders effect is really critical because so many times nowadays bystanders just get frozen. They may be a little bit freaked out that this is going on. They don't know what to do. They don't know if they want to intervene in this situation because it might become dangerous to them. Or worse, bystanders get out their cell phones and then they start filming it. And then again, you have the social media coming in later on and it's all over the place. So not good behavior on either end. But research has shown that if the bystanders feel that their social self-efficacy comes into place, they can help to defend the victim. And it can help to pull away from that situation, pull the bully and the victim apart. Also, spending time with a student, talking to him or her, helping him or her get away, and giving advice seem to be the most helpful actions that bystanders can take. And students who experience bullying are more likely to find peer actions helpful than educator or parent intervention or self-actions, with them trying to take power over the situations. So that could be some helpful information if we are involved in seeing violence happening in front of us.
Yeah.
Yeah.
What I see in clinical practice, and this is both with children, adolescents, and adults, is that frequently the bully feels impotent or incapable of defending or standing up for themselves. They don't feel empowered. And through therapy and the process of working through their inhibitions, the patient can become empowered to self-defend or even become empowered to really feel for the first time that they have, as you said, self-efficacy. Mm-hmm. They can protect themselves. They can stand up. To our home viewers, if you are bullied and have been bullied over a period of time, which is typically how this occurs, there are a number of things that you can do. Number one, I think it's important to understand what your inhibition is to protect yourself against the bully. Do you feel less than? Do you feel frightened because of the difference in size of you against the bully? Do you feel that the bully is smarter than you? The bully is more capable of getting other kids on their posse to bully you? If that's the case, you can report it. Now, most kids don't report it, and a lot of adults don't report their bullying because they're afraid of the shame and they're afraid of the consequences of reporting it. But as Julie-Ann said, we have to report. We have to be our own advocate, if you will. We have to say, I'm done with this. I will not put up with this anymore. When I was a freshman in high school, I was bullied for a solid year by a kid a third my size. And every morning at PE, he would taunt me, push me, and cajole me. The bystanders, my peers, watched this, and I felt horrible. I felt like I had no power. I felt like he was stronger than me. And for an entire year, I put up with this. My friends used to say, Gerry, why don't you fight him? Why don't you push him away? I just didn't feel strong enough. The summer of my freshman year in high school, I started surfing, I started working out, and I developed a sense of self. The second year, the same scenario. I'd go to the locker room. This kid, Jimmy, would start taunting me. And one day, on the second year in high school, my sophomore year, I just threw caution to the wind and I punched him in the face. I knocked him into every locker in the boys' locker room. And you know what happened? He never taunted me again. Surprisingly, never came at me. In fact, he wanted to be my friend. And I found that that was one of the most empowering situations. You can hear it in my voice. You know that is absolutely imperative, that we take control, that we advocate for ourselves, we find our power and our core, and we defend and protect ourselves from those that want to steal our power. You know, also I discovered that violence, as I got older, violence is not the only way to self-advocate. There are other ways of doing that. We can use other methods to protect ourselves. There are legal methods, there are other social methods, but most important is the reporting of it. We also tell that bully, we're not taking this anymore.
If you find that you have been the bully, which we can do every once in a while, all of us, sometimes we can have our moments of trying to control situations and coming off a little more strongly than what we want. But sometimes realizing that if this has been happening to you, you've been in a bully role for some time, go back, look at your childhood, what happened in your household, because that's usually where bullying starts happening. That's where bullies grow, is from I didn't get enough attention at home. Maybe I was physically abused, verbally abusive parents or caretakers. We need to look at that realistically and find out how is that impacting us when we get older. There are better ways to have communication with people and get our needs met by more positive methods than by bullying, because that leads to a destructive path. So just get some therapy or find somebody that's going to be supportive and say, hey, you know what, I've got this in my background and I don't want to do this anymore, because I've dealt with a lot of bullies and they do feel a lot of shame on the inside. And sometimes they end up crying about, this is what I've done in the past and I can't believe I've done this. It can be changed with help.
Addiction is the greatest public health crisis of our time and the #1 killer of young people in America today. At Beginnings Treatment Centers, we offer safe, modern, effective treatment for substance abuse and addiction. Minutes from the beach in beautiful Orange County, California, Beginnings offers comfortable surroundings, private chefs, and a dedicated clinical staff. Beginnings makes recovery possible for you and for your loved ones. Don't wait until it's too late. Call 800-387-6907 right now for a free confidential assessment.
Hi, and welcome back to Psyched with Julie-Ann Goode and Dr. Gerry Fishkin. We're going to be talking about Gerry's new book, The Science of Shame and Its Treatment. It just received the Best Psychology Book of the Year by the Book Publicist of Southern California Irwin Award.
I've got a lot of gratification from having received that award. It's a validation of what I have been doing in my work with shame.
So, Gerry, where is the location of shame in our brain?
I'm glad you asked me that, Julie-Ann. Shame is located in the basal ganglia, and that is this dark area here. The basal ganglia is part of the limbic system, and the limbic system is that area in our brain that is associated with fight or flight. And it's a very interesting concept how, or not only a concept, but it's a very interesting process that shame is not only a behavioral thing, if you will, but it's also a neuropsychological or a neurological event. In other words, when shame happens, it happens very quickly. And I'll get into the more of the dynamics of that as we move through this. But that's about what happens. It's living in the old part of our brain.
Okay, so Gerry, what is the difference between shame and guilt?
The difference between shame and guilt has become a topic of interest. In fact, one of our close friends had been to church and the pastor was talking about shame versus guilt. I really want to tell you what shame is versus guilt. Shame is what we call an affective reaction to a perceived attack to oneself. What is an affect? An affect is like pre-emotion. It's not like any of the defined emotions, sadness, depression, anger. It's indefinable. It's something that happens to us. It's a sense that something is happening to us that is not associated with cognition or thinking. And we'll see as we move through this that cognition and thinking is not associated with shame at all, because when we have a shame attack, we're not thinking, it's an immediate reaction. At the precise second that shame is triggered, we want to disappear, become invisible and anonymous. Again, it's not a cognitive reaction. At that precise moment, our sense of self is wounded, if you will, or re-wounded. At that moment, we are emotionally hijacked. What does that mean? There's no cognitive component to shame, to a shame attack. It's entirely affective and automatic. We're held captive by the attack, and it reinforces exactly how we feel about ourselves. I call them affective signatures. That is, because of the repetitive nature of the shame wound, it's almost like a signature. When it goes off, we know how it feels because we felt it before. Guilt, on the other hand, is a cognitive and a definable reaction to the breaking or breach of a learned value. It requires thought and action. We know that if we steal something, we could be punished. We know that if we hurt someone, there are negative consequences. So whenever we do something wrong, typically healthy people fear discovery and experience anxiety. Guilt triggers the sympathetic aspect of our central nervous system and often causes us to secrete adrenaline. Shame is about our sense of self, who we think we are. Guilt is about something we've thought or done. Shame is about our sense of self and who we think we are, and guilt is about something we've done or thought about doing. So put more precisely or succinctly, shame says, I'm bad. Guilt says, I've done something wrong. So shame is always about our sense of self.
Very true.
Thanks.
What are the causes and effects of toxic shame, Gerry?
Oh, there are many, but I think primarily unprocessed trauma is directly related to toxic shame, like being bullied. A lot of kids never process their trauma, and unprocessed trauma from early life abuse, neglect, violence, abandonment, or toxic environments causes children to react in a certain way. It always has an effect on our sense of self. And I define toxic shame as the addictions, mood disorders, compulsive and other personality disorders. So when I talk about unprocessed trauma, if trauma is not worked through, it has a profound effect on our sense of self. Toxic shame represents itself often, Julie-Ann, as low self-esteem. I'm not good enough. I'm not perfect. On the neurological and personality side of the equation, these infants, suffer significant bonding issues. Many become avoidant. They fear abandonment later in life, and they do not attach. They frequently have toxic and terminal relationships with others. As they get older, we see many folks who suffer from toxic shame and are shame-based have many divorces and serial relationships. They can't seem to hold on to a primary relationship in their life. These kids are often fearful and have a strong limbic fight or flight, and they're frequently exhausted. And we hear about fight or flight, but there are really three components to it: fight, flee, or freeze. And many of these kids will either fight, flee, or are frozen and held captive by their own fears. Many of these kids lack compassion for both themselves and others. And then what is compassion? I've done a major look at what compassion is, and I find that it's two primary components. One is attunement. That is attunement with self and attunement with others. That is being on the same page as another. And the other component of compassion has to do with empathy, or is empathy. That is empathic understanding, feeling for the other as you might. That allows us also to feel something about ourselves. And if we have those two components of attunement and empathy together, we can have the experience of compassion. Lacking trust, both for self or others, is a major issue with shame-based individuals. They never, ever feel safe anywhere. They never feel a sense of trust, because trust comes from that early bonding experience, typically with a mother. It's never really with the father. That bonding is typically the infant and the mother. The mother provides that warmth, that sense of bond, that sense of safety and security. All of these factors, Julie-Ann, are represented by negative self-talk. It's the constant chatter in our head, but not thinking. It's not thinking, it's not rational, and it never represents reality. And any one of you out there who has ever experienced or experiences now toxic shame or shame-based behavior, you know what self-talk is like. That constant, unremitting chatter that says, you're not okay, you're not good enough, you're bad, this is not good, no one wants you. That is a toxic and terrible way to live your life. And what I find is that sense of self-talk, that self-talk is like what we call an endless tape. In the old answering machines, it would have that outgoing tape, hello, you know what that message is. And that's the message in our head over and over and over. We're not good enough. And again, that doesn't represent reality, but it does create our reality. In lieu of the primary abuser with shame, those with toxic shame take over the process of self-victimization. And again, I think that pattern of thinking, that pattern of toxic and negative self-talk, that unremitting negative chatter in our head causes us to feel bound up, if you will, and causes us not to do reality testing and not to really see how far we can go to get away from that horror. Children and adolescents become emotionally fixated or stunted at the age the abuses or violations to their sense of self began. They may grow chronologically, certainly, but not emotionally. They're affectively armed and highly triggerable. We call this, again, limbic hijacking. They're always waiting for the next shoe to fall. But that's just life, folks. There is no next shoe to fall. But kids that suffer limbic hijacking are always waiting for something negative to happen that validates that they're not good enough. Clinically, we frequently see these individuals withdrawing or terminating therapy when cognitive behavior therapy is used as a primary treatment modality. They have a lot of repressed or unprocessed anger and resentment. Their behavior is either inhibitory, they overcompensate, or just freeze. And what I found over the years, and one of the motivators for writing this book, or at least trying to find out why patients with toxic shame withdraw from therapy, and about 40 to 45% withdraw or terminate early, is that when we get to the early life abuse, trauma, neglect, or violence, whatever it was that violated and affected their growing sense of self, whenever we get to that point and it's not been dealt with previously, they withdraw from therapy.
So, Gerry, what are the effects of shame?
I think the effects of shame are our greatest fears on steroids. For instance, being shamed, not being good enough, going crazy, losing a relationship, feeling like a failure, emptiness, displeasing someone, being seen as a phony, not mattering, being abandoned. And finally, these children do not know how to self-soothe. And most often, they're soothing with alcohol, drugs, or other things that alter their sense of self and alter how they think. In other words, toxic shame is the royal road to addiction.
How are addictions linked to shame?
I think a sense of personal emptiness and a sense of needing to be filled up with something is a prime motivator or mover with shame. And I think many addictions, as I said previously, are developed because children are trying to alter how they feel and think about themselves. They're trying to stop the toxic and negative self-talk. They're trying to feel empowered somehow. But remember what I said earlier. When a child is abused, abandoned, neglected, violated in some way, they become emotionally and psychologically stunted, primarily emotionally, at the age that that addiction begins. And what we see clinically, and I know you do this work because that's the world you live in,
Yes.
is you see adults, but their EQ is probably 12, 30, whatever age their addictions
About 12
began.
years old, a lot.
Yeah.
That's what I've been finding, yes.
You see that. So you have to get their emotional quotient up to their chronological quotient, if you will, their chronological age.
Okay. And lastly, how is shame and toxic shame related to bullying that we started off with talking about?
When I had finished the book, my publisher said, Gerry, we have 2 pages at the end of the book. We'd like to fill it up with a summary. And it's in an afterword. And I said, an afterword? Well, I'd been thinking about this for a really long time as I was writing the book. And I was looking at who suffers toxic shame and socially. So we're getting it out of the domain of hypotheticals or theory into the real world. And I found that 16 to 26-year-old shooters often have toxic shame. Those kids that go into schools, they go into public places, and they take people out. These are individuals who, as I study them, we find that they have low self-esteem and self-worth. They're neglected, abandoned, violated, and abused, and emotionally isolated kids. They're angry, and they got that fight or flight, but they don't have the freeze if they're acting out. And psychosocially, we frequently see these young men and women becoming easily attracted to radical and extreme groups such as ISIS and other radical or extreme organizations where they can identify and feel a part of and feel empowered, even though it's sociopathic and antisocial behavior. And these disenfranchised boys, and to a lesser extent girls, don't feel like they matter, and they look for leadership that will give them direction, meaning, and purpose in their life. We're all looking for direction, meaning, and purpose in our life. Look around you. Everyone you see shares a deep and terrible secret that no one ever talks about. It is, in fact, one of the best kept secrets of all time, as universal and natural as the air we breathe, and just as pervasive. No one is immune to it. Look inside yourself. We listen to it instinctively, hold it closely, impetuously, and follow it without question every moment of our lives. The secret is our inner voice, the self-talk the primal and silent internal communication that form alongside our psyche, feeding us constant messages that control our behavior. We hear it, but we can never see or feel or detect it in any other way. If you'd like to learn more about the relationship of early life abuse, trauma, neglect, violence, and its relationship to addiction, please pick up a copy of my new book, The Science of Shame and Its Treatment, available at a bookstore or online. Thank you very much.
Thank you to our sponsors, Parkhurst Brothers Publications and distributed by University of Chicago Press, Beginnings Treatment Centers, and especially Therapy Cable.
So if we've met the if test, that is, if we're interesting, informative, and fun, I encourage you to tune into our next episode of Psyched at therapycable.com. And if you'd like to reach us, you can contact us through the rolling credits at the end of the show.